Representative Pryor will be moving House File 3737 for placement on the General Register. That is your motion, Representative Pryor?
Thank you, Mr. Chair. That is my motion.
Excellent. And I do believe that you have an amendment.
I do.
The A1 amendment. So we'll have you move the A1 amendment to put the bill in the shape that you wish.
Yes.
That is your motion? Okay.
Thank you, Mr. Chair.
All
That is
right.
my motion.
Any discussion on the A1? Hearing none, all in favor of the A1 motion to put the bill in the shape the author intends. All in favor say aye.
Aye.
Aye. Any opposed? Okay. So then, Representative Pryor, please present House File 3737 as amended.
Thank you, Mr. Chair and members. This bill, what we're trying to do here is falls under that category of federal compliance and conformity. So we do have a block grant, that's a federal block grant, and to administer here at the state level, we need to be consistent with the language and different requirements. And so we're just trying to clean things up and continue with our federal conformity. And I do have a testifier that can walk us through the bill and explain in detail.
That's great. Ms. Fraser, please introduce yourself and then proceed.
Thank you, Mr. Chair and members. Beth Fraser with the Department of Human Services. As Representative Pryor said, this bill does include the remaining elements of federal compliance related to training requirements. It also includes a number of provisions that we are supporting after being in conversation with family child care providers. The issues related to training stem from the federal law, which requires that everyone that federal law considers a caregiver has to have training. And so federal law defines caregiver as an individual who provides child care services directly to an eligible child on a person-to-person basis. And so there's been some discussion about, well, it doesn't say a substitute has to have this training. And we've said, well, but if they're not providing child care services, then what is their role? I mean, and that is what the federal government has said to us. If they meet this definition, regardless of what the state calls them, they are required to have training. So when we first began discussions with family child care providers about this requirement, the initial concern was, what if there's an emergency? What if I have a heart attack and, I need somebody to stay with the children while I'm being, taken away in the ambulance? And so last year, in response to that, there was a bill, and we provided technical assistance so that in a true emergency situation like that, where the child care provider for unforeseen circumstances needs to close their business for the day and is going to have somebody stay with the children until the parents can arrive, that person is not required to have training or a background study, because we do not believe they meet this definition of caregiver, because they are just there to make sure nothing bad happens until the parents get there. But if they're spending more time and are scheduled, then we believe, and the federal government has told us, they meet the definition of caregiver and need to have training. And that requires a number of changes to our current training requirements. So most of the gaps in state law relate to people who provide substitute care. So somebody who is providing care instead of the provider. We currently have a few different requirements for substitutes depending on how much time they provide care. And so currently there are some substitutes who only have to have first aid or only have to have sudden unexpected infant death prevention training and abusive head trauma training. And that is the training required if you provide less than 30 hours of care a year. If you provide between 30 hours of care and 30 days of care, you're also required to have first aid and CPR. And then currently, if you provide more than 30 days of care, you have to have all of the same training that the provider has to have, which includes health and safety trainings and child development trainings. So this, in order to come into compliance with federal law, would require substitutes to have all of the federally mandated training. In order to make that as easy as possible, because we understand that this is an increase for those substitutes, the department has developed a shorter class to cover all of the federal health and safety training topics in one 4-hour class that also covers child development, because those are kind of the new requirements. So it could all be done in one fell swoop in one 4-hour class. There are a few other gaps that this bill addresses. There's some instances where you could have a second adult on site, and as long as the first adult has CPR or first aid, the second adult wouldn't need it. That does not comply with the federal law.
And Ms. Fraser, I might ask you to wrap up in the next minute or two if you can. I just want to make sure that
Yes,
we can go
sorry.
to questions. Sure.
Yes. So this addresses those federal changes and federal requirements. It also, in addition, does a long list of things that we have discussed with providers and heard from providers that they want. One is it broadens the definition of substitute so that if somebody has all of those federally required trainings, somebody could use one of those people, which is still a lower standard than what the providers have to have. They would have all the federally required trainings, but not everything a provider has to have. They could meet that standard and provide up to 500 hours of care annually, which matches another change that was made last year. It broadens time that a family member can spend with the provider's child, or it broadens who can spend time so that it's somebody related to the child, not necessarily to the caregiver. I'm happy to walk through everything. I'm also happy to just answer
I'm
questions.
kind of thinking, why don't we be driven by questions?
Yeah,
that's-
sorry.
which is just fine. Yeah, we can be driven by questions. Let's, if we can, though, I'm thinking, why don't we'll, I know Ms. Cunningham, Ms. Leopold had wanted to testify as well, and so why don't we do that? And then Ms. Fraser, we'll probably have you come back
Sure.
for questions too. We'll make sure to give you 4 stamps on your frequent testifier card, so you can.
Thank you.
So next time will be free or 10% discount or something.
Mr.
So,
Chair.
So please, Ms. Cunningham, just confirm your identity and proceed.
Mr. Chair and committee members, Cindy Cunningham, family child care provider, and McPinn Public Policy. The substitute training, for most providers, these substitutes are 30 minutes here and there. They are often family members. I actually have found someone who is working as a contracted substitute, so I can be here more often, thank you. But on all of these things, it's so that we can balance our lives. It's so that we can step away, so that we can be a part of what most providers started these businesses for, was to be more engaged with our families. And yet then we get restricted to the 7 to 5:30 or whatever the hours are, and we cannot remove ourselves from that setting unless we close. And then we are really caught between parents needing to work, and the squish becomes as far as the frustration. Do we charge? Do we not charge? And then how do parents handle their own children when they're closed? So it's a very complicated setting and pressure on our part. We do understand that this is a part of the federal block grant. The part that I want to just share at this point is that there is a lot of frustration about the amount of change, and I will say attack might be a little extreme, but we've gone since 2013 with the union, with the Safe Sleep, Universal Pre-K, and now all of the changes here. So I would say the response for family child care providers are that we're wary of change. So the things, and I have been in discussions with DHS and in Bennett meetings, and I really appreciate that there is a shortened course. What we need to continue to, so I'm not used to talking to people all day like this, but we need to continue to receive is things like a year implementation, so that providers have time to reevaluate their businesses, implement their businesses, and have people to be fully trained to be able to do this. And also the communication, even though DHS has done a significantly increased ability or presentation of communication. In January, I was at a county training that I was giving, and the providers had not received the implementation plan from last fall. I heard from a provider this morning. Many people just got the information about the training changes for last year. that's the county delegated struggle that we're under. So to then put this on again, that's the part that really, really needs to be honed and continue to be increased with it. So the technical assistance is a critical piece to allow us to catch up. We do have some concerns with the CPR first aid being removed from the CPR first aid experts standards. At least for the first time, I could go 3 years with having only, having had my CPR first aid and in between my training, instead of the 2-year that's recommended. We would at least like to make sure and ask DHS to ensure that providers are aware that they are out of compliance with CPR and first aid standards. There are some refresher courses that are available, and if a provider thinks, well, I don't have to get trained on that 2-year time period, and then they reapproach their trainer, they would then have to take a longer course on that part. So they at least recognize the 30-day also. As far as cars, we would like to see that providers are not allowed to transport if their car's training is not up to speed. I'm a car seat technician. The adding of the KCFs is critical in statute to be able to assist providers and counties to implement that correctly.
Good, thank you. Thank you so much. And Ms. Leopold?
Kim Leopold, Association of Minnesota Family Child Care Licensors. I'm kind of going to go a little bit differently piece by piece, starting with the supervision of the family child care license holder's own child. As licensors, we understand the spirit behind the bill. What this means is that anyone who is related to the child can come into the family child care home business and remove that child, the provider's own child, from the daycare area and take them into another area of the home. We understand that this was grandparents visiting, aunts and uncles, things like that. I have had a provider ask me if her 12-year-old daughter can take her infant daughter into another area of the home, and I have to say yes right now. So we are in the business of supporting providers, obviously, but also keeping children safe, and I don't know how we can word that better, that it's, because they're not required to take any of the training, so they're not held accountable, so anyone who's caring for those children could put an infant in a unsafe sleep space. And I just, that's risky to me and concerning. Again, I understand the spirit behind the bill, but sometimes the spirit isn't always what the providers see and realize. So that's a concern from AMFCCL regarding that. And then I have a question, just a question. Is it any number, is the substitute any number of hours? Like if they are doing any number of hours, that training?
Well, we can,
Okay.
we usually do it differently, but that's okay. We can have you, but let's
Oh, it's all
get a
right.
clarification.
I'll keep moving.
Okay, all right.
And then there is some pieces in here regarding providers being allowed to, so to Ms. Cunningham's point, CPR first aid has to be taken every 2 years. That is what American Heart Association, American Red Cross, those places require. You are out of compliance with those organizations if you don't take it every 2 years. In this draft, it is allowing providers to not take that training at the expiration of it, but allowing it to go until their license expires, and that could be a really long time. And I know the reason, because I've been in contact with Ms. Fraser as well, I know the reason is to maybe more align with centers. The difference between centers and family child care is that in centers, there are other people present with first aid and CPR. When you're the only caregiver, it could lapse 6 months. First aid and CPR could lapse 6 months or more if it doesn't fall where your license falls. And again, to protect the health and safety of children, that is also concerning. So that's first aid and CPR, and as Ms. Cunningham testified to, the CARS training, that's the car seat training. Again, that is through usually like AAA or the Minnesota, or the Public Safety Department. That expires after 5 years. And again, they'll let that lapse until their license goes, and we have a concern with that. The other thing is ensuring, there's a lot of language in here about ensuring training of people, and we would prefer that if it says document, ensure, we do have providers that lie about their training. Ensuring means what? That they write it down. It doesn't mean that there's a documentation of it. And I just would like to continue to see the documentation of it so we can see that providers and substitutes have taken the training. The other thing that's in here that's too big, I get it. There is a section under subdivision 7E that talks about where providers can take training through, and the way I read it, and I could be wrong, is that they can only take it through the develop tool, which is where most providers get their training, but there are other options available, and that is college courses, college training in other states. I know in my county, we offer training a few times. Yes?
No, yeah, if you could just wrap up, please. And I might just pause for a second, just to understand because I believe this is, we need to do at least significant components of this for federal compliance, so we don't avoid a significant federal
Correct,
penalty.
but
Yeah.
the items I'm speaking to are not for that.
Yeah.
Chair?
Mr. Representative Heitzman, yeah.
I'm sorry to interrupt. I'm just looking at the clock like you are, and we have about 6 minutes
Yes.
remaining. Would it make, I didn't hear the motion. What are we doing with the bill?
So the plan is for it to go to general register, but what I'm thinking, Representative Heitzman, is let's just see how far we get here. And you can tell, I'm not extending folks beyond, so Representative Heitzman, yeah.
You've been really generous with the time. We've had a lot of bills to discuss, and we've had a lot of questions. Would you consider laying it over so we could talk more about it? Because there's a lot.
So Representative Heitzman, so here's the thing, I definitely will, but let's spend the next 5 minutes, and then if we hit 9:30, and there'll be I think there'll be a good argument at that point, but rather than take time discussing whether or not we do it in 5 minutes, let's just take the time to do whatever we can now. So Ms. Leopold, if you could please wrap up with anything, if you got any final points there.
That's okay.
So, okay, thanks. So Ms. Fraser, we'll see if anybody else has anything, but can you just remind us, Ms. Fraser, what portion of this is required by federal compliance and what portions are not?
Mr. Chair and members, the changes related to increasing training requirements are related to federal compliance, but another piece that we're doing here at request of providers is rearranging the statutes and putting all of the training into lists of here's exactly what you need to take when. And so it's not easy to pull out necessarily, it's not just this one section, it is sprinkled throughout the whole bill. So it is not easy to point to exactly which section does what. I would, if I may, very quickly, I would say that in terms of the CPR, first aid, and CARS training, there was a proposal last legislative session from a different group of family child care providers asking that they get additional time to take trainings like this. We thought, well, that's reasonable, and so we have included it into our proposal. And so so there is obviously difference of opinion among providers and licensors, but that's where that came from. And there is still a requirement that you document all of the training on page 15. So we are not erasing that.
Thank you. So here's what I'm going to do is let's first of all see if there's any, and so please, our testifiers, please stay close by. First to see if there's anyone else in the audience who wants to testify on the bill. Let's just make sure we get that addressed. I'm not seeing anybody come up. And so what I'm inclined to do is we'll spend the next few minutes, we still got another 5 minutes to chat through things, see where things stand. I guess I will just confirm for all that significant portions here we know have got to become law this year, or we are out of federal compliance. I guess we already are out of federal compliance with these points and potentially get a significant penalty. So just as we're sorting this through, but we'll have a series of questions go from there. So Reverend Heitzman, you're up.
Thank you, Mr. Chair. My first question is for Ms. Fraser. When you started your testimony earlier on the other side of the desk, you made a statement that kind of popped off a little bit of a question mark in my mind. What did you mean? And I think I got it pretty close. We are suggesting, we are supporting, after talking with child care providers, and then you went on to describe what the bill does. What does that mean?
Ms. Fraser.
Mr. Chair and Representative Heinsman, what it means is that the pieces in the bill that are in addition to federal compliance come from stakeholder engagement, from conversations with providers and others about things that they would like to see changed.
Representative Heitzman.
Thank you, Mr. Chair. So are you supporting those changes or not that came out of the discussions with providers?
Ms. Fraser.
Mr. Chair and Representative, we are supporting them.
Okay. That was
Representative Heitzman.
clarification. Thank you, Mr. Chair. To the bill author, Representative Pryor, I know that a lot of the discussion over the last year and a half has been centered around reducing regulatory burden for providers. That's been an ongoing piece of the conversation, no question about it. So I know we've heard a couple of different concerns that the testifiers brought relative to provisions in the bill. I'm hoping you have a list of things that this bill does, which it's lengthy, so I'm assuming there's got to be something specific you can point to, or a list of things would be even better, that are driving towards trying to get at that issue for providers, the regulatory burden that they're facing. And I think the quote that I heard out of some of the testifiers was that the regulatory requirements have taken the joy out of what brought them to providing care in the first place. So-
Representative Pryor.
So I appreciate the question. Thank you, Mr. Chair. Thank you, Representative Heinzman. And so this bill actually, we've been working on it all last year as well as this year. And I sat down with a number of different providers and representatives of those groups, and working also with, the folks in DHS, Ms. Leopold also, just to keep hashing through these things and get that right balance between, we do have this underpinning of federal requirements that we have to do and that we can't fudge on. And it is regulatory. But it comes from the federal. But then there's other things, and I think this is this lengthy list that is in the bill. And what it is trying to do is, well, first of all, make it easier to comprehend and more transparency by pulling things together and talking about training in one place. And that is, at the request of the providers to, not only is it the amount of regulation, but your capacity to understand the regulations. And so that's something that this bill is trying to do. So to your point, that is where we're heading. And, we could follow up and it obviously is something that would take a lengthy conversation to go through point by point how this impacts a particular provider. But we could do that, offline and really get into the nitty-gritty of it. And then so these are the discussions that I've had in the past. And, maybe, and if I may, I'll turn it over to Ms. Fraser, just maybe to give a couple examples.
Let's have
Is that
Ms.
possible?
Fraser, please.
Mr. Chair and Representative Heinzman, I just want to point out that the concerns that were expressed this morning were about that DHS, that the proposal goes too far and would allow providers too much time to take training. Just to be clear, the concerns were you're going too far. So I just want, there are some providers that said, we want until our expiration date to take training. And the testimony this morning was, whoa, we're worried that's too much time. We're worried that puts children at risk. And so just to clarify what was heard this morning.
Representative Heinzman.
Thank you, Mr. Chair. This is, the testimonies kind of helped me out. I guess I would argue, make my point, and I hope that if this bill does move out of this committee today and we don't have a chance to really get a hard drill down into the issue that I'm concerned about, and that's a regulatory burden and a list of things, maybe on the House floor, we could provide members a better opportunity, this is to obviously the bill author, to know exactly what we're doing, driving at that issue. Because if I've heard anything from providers and from parents, it's been the regulatory burden is really, really difficult. To Ms. Fraser, I think that you had mentioned something relative to our compliance in federal law, and the bill author also, Representative Pryor, but the changes that we're specifically making in this bill, are they required for federal compliance, or is that something we're doing here in Minnesota for other reasons?
I think we sort of got an answer to that before, but Representative Pryor.
Right, and so this is what we were addressing before, and particularly that section that was described in detail about what's called a substitute, but is actually in the federal requirement calls that person a caregiver. And that's not something, that is that's why we're, this is the part that we need to be in compliance on.
Mr. Chair.
Representative Heinzman, yeah, we're almost done, and so we'll let you go, and then I'll.
Chair, the
we'll
reason
go
I'm
from there.
asking is because there are cases, and I'm sure you see them, where we interpret federal rules a certain way, and agencies try to implement those things. I'd like, if there's a way, Mr. Chair, to know, is this an interpretation of what those federal rules and those requirements are? Is this something that is something we can, it is in stone, or is this the way we view it? And so I don't know if that question has been answered yet. That's why I asked again.
Sure, and the impression I got was that there's not a claim that everything in this is required by federal law. Some of these things are required by federal law as I think as a sort of fair interpretation. But as long as those are happening, then there's other steps trying to respond to concerns from family, child care. And I want to point out that, of course, we do some of that in some other bills as well. So here's what I'm inclined to do. So Representative Pryor, I'm inclined, because it is going to be going to the General Register, to lay the bill over at this point. I know there's several folks who also have questions as well, and certainly there's some specific points made. And so I would expect we'd get back to it pretty soon. So even next week, we've now had public testimony, et cetera. And so what I'd ask, especially for our two testifiers, Ms. Cunningham and Ms. Leopold, to connect with you and with the department, because I'll just say, some version of the bill needs to become law in order to meet federal compliance. At least there's some components there. So as there are specific areas that were identified in the testimony, please encourage them and anybody else to work with Representative Pryor to address specific concerns in specific sections of the bill. With that, and so then members will get back to the rest of the discussion. I know we've got a couple members as well. I expect Representative Heinzman may have some other pieces, and we'll do that when we bring the bill back up. Does that make sense to you, Representative Pryor? Okay, good. I'm seeing a nod there. So with that, I'm laying over House File 3737 as amended.